Hello, everyone. My name is Brad Snyder. I'm the superintendent here in New Albany-Floyd County Schools, and with me today is Dr. Tom Harris. Dr. Harris is the Floyd County Health Officer representing Floyd County. Dr. Harris and I have been working together all summer and all fall, and quite frankly, daily this week as the resurgence of COVID-19 is strong in our community. We've been talking about the best interests of what we need to be doing for our students and our community. And here in just a short minute, we're going to make a community announcement that will impact many. Before we get to the announcements, in the spirit of the Thanksgiving season, I do think it's appropriate for all of us to pause and be thankful and give gratitude for everything that everybody's done. No one in our audience has asked for this virus, and it's been difficult and very trying for all of us.
We appreciate all the hard work, commitment, and devotion by all parties concerned with education in Floyd County. The fall semester was well planned and well carried out. The community has shown a great sense of adaptability and responsiveness to changes in the COVID pandemic in our community. Each group has shown great skill in responding to the hazards that have been thrown up by the pandemic.
And I would be remiss if I didn't give a big shout out to so many groups. Our parents have responded appropriately. We know that we've asked a lot of them. We know things have changed. Our teachers have been amazing. They've undergone more transformation than any workforce that I can think of. Our bus drivers, our administrators, our healthcare workers. I couldn't ask for more from a supportive community. Before we move on here, let's just take a minute and give everybody our assessment of the status of education here in New Albany, as well as the status of the public health out in the county. First of all, I want to start off by saying how incredibly proud I am of the efforts that our school community has put forward for our kids. Today, I think, is day number 62 of in-person instruction. We're very proud of that because a number of communities across the country and really across the river have not had any. They chose a different path. We chose in person, and I think we've been successful thus far. But at the same time, in the last few weeks, there's just no doubt that the increase with the virus's presence has had an effect on us. We have had significant increasing numbers of positive cases with our students and our staff, but probably more importantly, the number of quarantines that are required to mitigate that has impacted us dramatically. Those of you who are on our call list know that Bill Briscoe has been very busy. My phone is going off all the time, and that should give you some indication as to the changing nature of this. And as we move forward, it's kind of our duty and our job. We have to balance and prioritize the safety needs and the health conditions for our students and our staff, as well as our parents.
In Floyd County currently, we are seeing an uptick in cases. We were reclassified last week from the yellow category to the orange category. Our county is closing in on the red category this week. The state 7-day rolling average in Indiana has been the highest in the last 7 days of any point in the pandemic. We have certainly seen a marked increase in number of cases here in Floyd County. Additionally, the case totals have doubled every week in Indiana for the last 4 weeks. More locally here, we have seen our under 18 rate almost double in the first 15 days of November from the average total of October. The October number was 8.09, and for the first 15 days of November, it's 14.73. We've seen an increased number of cases in all school age groups. Recent studies have shown that the hybrid model of education, where students are split into groups and the groups do not cross paths, can tolerate community rates up to near 20%. However, we're currently seeing community rates that are approaching that number. We also know that short-term closures for just 1 or 2 days are not effective in altering the disease trajectory in our community, that the minimum number of days that we can reasonably expect to affect the rate is in the 14+ day range. And in addition to the staffing problems that Dr. Snyder has talked about, we have seen staffing shortages and service issues in all sectors of our community due to both sick people from COVID-19 and the quarantine of their close contacts.
Dr. Harris and I have made a joint decision after looking at all of the available data and the options that are available to us by the Indiana Department of Health as well as the Indiana Department of Education. We've had many meetings, many interviews, and talked to a lot of stakeholders in our community. And we have found the common thread that everyone in our community wants to do the right thing for the long-term interests of our students.
Decisions regarding the method of instruction are not made hastily or lightly, as we are all aware of the complications and implications of our decisions.
We are going to be shifting to a total e-learning platform beginning on this Friday, which is November 20th. Therefore, Thursday, November 19th, will be our last day for in-person instruction. This applies to all of our students, including Prosser, and so all students, with one exception, will be learning. And that one exception are our students who have intense interventions. They will still be picked up and they will still receive direct services. So we have a couple of days here to get organized. Everyone's going to need to come in and make sure they have their devices, their chargers, their daycare, transportation situations worked out. Our teachers will appropriately need to switch lesson planning activities so that we're ready to begin on Friday. We are going to continue on our e-learning path all the way up to the end of this first semester, which is Friday, December 18th.
From a public health perspective, we hope that this 18-day shift to electronic learning from in-classroom learning will serve as a functional firebreak and lower the incidence of COVID-19 in our community. We think that this measure will actually alter the trajectory of the disease in our overall community. There's good research from the closures in April and May that shows that school closure saves lives in addition to the students that are saved from becoming ill. Our goal is to get students back to in-classroom learning as soon as possible, given the status of the COVID in our community.
And finally, I want everyone to know that we're also going to be reinstating our moratorium on community use of our facilities, at least until the end of the year. This includes all activities with the exception of our high school sports. This community moratorium is going to apply to our mini leagues, our recreational swims, middle school sports, etc. I also want everybody to know that we're not canceling these events, but rather we're postponing them with hopes that they can be rescheduled sometime after the first of the year or whenever it is that the public health concern is muted and it's safe to resume those activities.
Under the governor's color-coded system, the number of spectators at sporting events in high school can vary. I would encourage everyone to keep up with the New Albany Floyd County Schools website and also the Floyd County Health Department websites to learn the color status of our county at the particular time of the sporting event.
In closing, Dr. Harris and I both recognize that the COVID-19 virus continues to create many hardships for our parents, our students, and just really everybody in the community. And again, no one has asked for this virus. All we can do is navigate and do what we can to keep everyone safe. We're going to continue to monitor and follow the science and look at the data and the trends and do what we can to make the best decisions we can for everyone out there.
We continue to need community support, confidence, and collaboration to benefit everyone in Floyd County. Please continue, and in some cases restart, the essential mitigation measures. We need for everyone to wear their mask. We need people to wash hands and use hand sanitizer frequently. We need to avoid touching our face during interactions. We need to keep a social distance, preferably greater than 6 feet. We need to stay home if we're ill, and most importantly, we need to avoid large gatherings. If you become symptomatic or a close contact of someone who is, we recommend you get COVID-19 testing. Positive note for the future, we plan to start vaccinations for Tier 1 people starting in November. Unfortunately, pediatric immunizations will probably be in 2021.
In closing, I just want to remind everyone that this is truly unprecedented. None of us have ever lived through a pandemic before. We do need to be reminded about how fortunate we as a people are to have so many safeguards and so many people working in unison to provide a healthy community. I do appreciate all the work Dr. Harris has given us and all the things that our teachers and everybody has done. We're doing our very best. And in closing, I hope each and every one of you have a happy and joyful Thanksgiving. Hopefully it is as safe as you can make it. And we're doing the best that we can. And we appreciate all the support that you continue to provide.